Hello, my name is Dr. Samara Rashid, and I will be lecturing on Chapter 29 from the Modern Dental Assisting textbook, and that's edition 14, and it's about special needs dentistry and the medically compromised patient. You can find the beginning of this chapter on page 392 of your textbook. I'm having a little bit of a glitch in sharing my screen, but I think I have it down if I'm not mistaken. So we do want to talk about some learning objectives. We want to discuss the role of a dental assistant in caring for the special needs patient. We want to know about, pronounce, define, and know how to spell some of the key terms that are listed in the textbook, as well as defining patients with special needs. It's not always what we think it is. We also want to discuss medical, physical, psychological, or social conditions that make it necessary to perhaps even modify or change the dental treatment completely. And we want to discuss the importance of medical history for these patients. And also, we want to describe the major medical disorders that can affect a patient's oral health and dental management of these patients. So, nearly every dental practice cares for patients with special needs. People are nowadays living longer. It's not the same how it was, let's say, for example, 50 years ago or 100 years ago. And since people are living longer, they are keeping their teeth for a more longer period of time. It used to be that in the past, people were like, oh, well, at what age do my teeth fall out? And they're not talking about pediatrics, someone who's 10 years old or 2 years old. They're talking about adulthood and even perhaps geriatric in their geriatric age. So there is an estimated 2% of the national population that has some type of disabling condition. It includes anywhere from developmental disabilities, neuromuscular disorders, immunocompromising conditions, cognitive impairment, mental disorders, medical conditions, and trauma. So it's the responsibility of the team and the dentist to know about what are the needs of these patients. Patients who enter your dental practice, they could be sick, they could be in pain, they could be simply physically challenged, and your job will be to use good judgment when working on these patients. So the team and the patient's medical team must work together in order to modify any dental treatment that deemed necessary. So the role of us, the dental assistant, is to help the dentist in providing treatment. And we have to be able to serve as a source of information to the patient and to the family. Now, remember, as we said in the beginning of the course, many families or patients look to you for a comfort because most of the time, a lot of patients do not look at the dentist or even the front desk for comfort. They're already nervous to come for treatment. They're anxious. So they have a tendency to look at the dental assistant as a source of information. So making the patient feel more comfortable and reducing their anxiety is key. Some of the special needs patients some of the patients that fall in this special needs category are anywhere from the aging population. It could be developmental, physical, emotional, behavioral, psychiatric, and even medically compromised. But the aging population is basically the fastest growing segment of the US population. And people that are over 65 and older, they're around 13.7%. 13.7% of the population and represent around 1 in every 8 persons in the United States. And you can see the graph on the right, and then you can see kind of like the forecast as to how quickly it slopes upward with the red line. So it's estimated that by 2050, as you can see here, that people age 65 and older will make up 21% of the US population. So the older population is commonly referred as aging, and aging refers to the irreversible and inevitable changes that occur with time. We all are getting older, we all age. However, there are 3 categories to older adults, right? There's functionally independent older adults, there's frail older adults, and dependent older adults. Now, remember, someone who's, for example, 70, a 70-year-old will be different from another 70-year-old, right? It'll be different. One 70-year-old could be very independent, although they've climbed in age to the age of 70, but they could be independent. They could be more independent in how they live and how they work. And another 70-year-old may not be. So a functionally independent older adult is better educated, more demanding of health services than in the past, and they retain more of their natural teeth for obvious reasons. But a frail older adult is going to have the beginning of multiple health problems, and more of them have a tendency to have these removable dentures or removable prosthetics, or maybe even crown and bridge or fixed prosthetics. And then we have the dependent older adults, and they have fewer natural teeth, and they believe that tooth loss is actually a part of life. And they have a tendency to have medical conditions that are reflected in their oral health. Okay. The aging population can be faced with special oral health issues, systemic disease, overall poor general health. Maybe they have an increase in bone loss or an increase in periodontal disease. And maybe they have reduced manual dexterity, meaning it's hard for them to move their hands in certain ways. And that affects their oral health because then they can't carry out proper hygiene procedures on themselves. And then, of course, there's polypharmacy, where there's a whole bunch of medications they're taking and they have side effects like xerostomia or dry mouth, or maybe it causes them to shake or have tremors. So, all in all, the common theme is we have to have a thorough medical history in order to address some of these issues, and that reflects on their dental treatment and how we can treat these patients in the dental office. Okay, this is an example. This is more of a hard copy, but there could be actual an electronic copy of this. There could be a medical record that maybe the patient carries with them, maybe even a hard copy, maybe even it's on their phone. So as you can see in the first column, it'll say here, I don't know if you could see my mouse right here. It'll say what I'm using, the brand, the generic name, ingredients, active ingredients, and it'll go down the line. And then over here, it'll say the second column, what it looks like, the shape, the color, the markings. As you can see here, a 20 milligram pill. It's small, white, round, for example. And then you have the third column, how much of it do I take? So that's like 40 milligrams. I take 20 milligram pills a day. How to use it, start, stop dates, why I'm using them, and who told me to use them. So this is very helpful for the dental team and for the returning medical visit when a patient goes back to see their physician. So this is pretty helpful. Now, with the oral health conditions, I know we talked about some terms, but the book talks about xerostomia. And xerostomia, I think I mentioned a few minutes ago, that is dry mouth, and a dry mouth that could result from medication or maybe even from some sort of medical condition. And then if you remember, we did talk about earlier in the course, periodontal disease. And periodontal disease is this is which the tissues of older patients may be slower to heal. There's a loss of gingival attachment. Those gums aren't even they're not as, I guess, firm with the teeth that they attach to. There's an increase in bone loss, and there's also recession. And now that you guys have taken radiographs, or now that you've seen radiographs of your mannequins that you took in DNA 134, you probably have seen results of periodontal disease as it looks clinically in a patient, or even as it looks on a radiograph. So you see that difference. And of course, with recession, the teeth tend to look longer when patients smile. Okay, that's because the gums and the bones that support the teeth have kind of pulled away from the teeth. And then there's more of a layman term called tooth decay. In other words, that's caries that could be on the root or on the crown. So coronal caries or root caries. And even recurrent decay falls in this category. And that's decay or caries that are around a restoration or a filling that's present. Then there's dark and brittle teeth, and that is a result from the deposits of secondary dentin. So if you remember in DNA 108, your dental science course, we talked a little bit about secondary dentin that has now gradually reduced the size of the pulp chamber, and there's now an increased risk of fracture because the teeth are now brittle. So one of the benefits of getting older is that the pulp or the nerve tends to shrink or move away from the teeth. It gets smaller, so sensitivity might decrease. So that's one of the benefits of getting older. But however, all in all, the teeth start to get a little bit brittle and a little bit more dark. And then, of course, we have something called bone resorption, and this is the loss of the alveolar ridge. And many of you have probably seen that, especially with those people that have dentures, that they have, like, especially a full denture. If someone has to remove a full denture, when they remove it out of their mouth, because the primary function of the bone to support the teeth are now gone, and all that remains is bone, the bone tends to pull away and shrink. And hence you get bone resorption, periodontal conditions of an older patient. We talked a little bit about this just now. More than 50% might be affected by periodontal disease. Periodontal disease, remember, the older generation is now keeping their teeth longer. So, I mean, there are going to be problems. It's just that they're holding on to their teeth more. As a larger number of older people retain their teeth, perio disease will increase. There's recession, there's bone loss, and they get darker margins around fillings, as you can see here around this filling of the picture. Tooth decay, or rather caries, older patients have a higher risk for root caries, okay, and recurrent decay around worn restorations. So the gums recede, the roots get exposed, and so what happens when the roots are exposed? You get root caries. Remember, there is no enamel on roots. So if you remember from your teeth drawings that you're doing, or you remember from DNA 108, the anatomy of the tooth, there is no enamel on roots. And remember, what is the hardest substance of your body more than bone? It's enamel. So roots are meant to be buried in gums and bone. So when the gums recede, or even the bones recede, then the roots are exposed, and so they get caries. Teeth become brittle as we age due to increased deposits of secondary dentin, and that's reduced pulp chamber size. We mentioned this already. We also mentioned bone resorption. And as you can see here, root caries, you can see that in this case, some of it is caries, but there's some areas that have been filled with some gold filling. But then look around it. Now, I don't have an explorer to kind of touch these areas, but more than likely, or could be, rather, I shouldn't say more than likely, these are caries or deep staining. And you can see even a little bit of a fracture line in this patient. Look at the darkened restoration of this area on the tooth. And look at this darkened teeth, or attrition. So with time, as we get older, we do get darkened teeth. And this is a typical example. You can also see the wear facets on the incisal edges. And of course, as with many of the things we teach you in dentistry, there's always these categorizations, or categories of special needs patients. So a category 1 is a healthy patient. Category 2, you have medical conditions that require some sort of scheduling changes or shorter appointments. And then there's category 3, which requires significant modifications in the actual treatment planning. And then category 4, there's major modifications, maybe even in the operating room. And then category 5, there's serious medical conditions, and they're only limited to just, focused care. So this will aid in assessing patients for treatment, the time of the day, shorter appointments, etc. Let's talk a little bit about the medically compromised patients. We are a little scattered in this chapter, so just kind of letting you know about that. Some of the learning objectives is the medical disorders affecting oral health. So we want to describe the major medical disorders that can affect a patient's oral health. We want to describe the type of management and the clinical considerations a medically compromised patient would receive. So in terms of management, we always want to update the medical history. Well, first, we want a brand new medical history of a brand new patient. But subsequent to that, at all the other appointments that they see you later on, we always want an update of their health condition, their drugs that they're taking, medications, any previous dental treatment or present dental conditions, and the ability of a patient to modify or assist in their oral health. Now, with developmental disorders, the result of an impairment that occurred during the developmental phase of a person is what defines this. This is usually anywhere from prenatal through age, so before they're born, through the age of 18. So this impairment can occur prenatally, during birth, or even postnatally. Some of these conditions are, you got chromosomal abnormalities, we have Down syndrome or trisomy 21. I think that you have an extra chromosome in that one. You have autism, cerebral palsy, and intellectual disabilities. So many patients with developmental disorders, they routinely see a pedodontist for because they have extensive training, especially for patients that need extensive work. You always have to consider a patient's intellectual ability. So there is a wide range of cognitive understanding for those with intellectual disabilities. So there's key points for working with these patients. You have to speak slowly for understanding. Okay, no judgment. Speak slowly for understanding. Use common words for communication. Don't for you it may not seem high tech to say certain words like caries or anything from, whatever, mesial or distal. You really have to make it down even simpler than layman's terms. So use common words for communication. For those with autism, many have poor social skills. They may have language problems. They may not have eye contact. We don't know. It can vary. So you have to be mindful of that. With Down syndrome, Down syndrome is also called trisomy 21, where there is an extra chromosome there's an extra chromosome of the 21st group. So instead of 46 chromosomes, they have a total of 47 chromosomes, and they're 1 in 700 live births suffer from Down syndrome. They have more of a distinct look, slanted eyes. They have a broad, flat nose, shorter stature, and they do have some sort of intellectual disability, congenital cardiac abnormalities, seizures, maybe hepatitis, leukemia, URT disease, or upper respiratory tract disease. With autism, they have difficulties in three main areas: social interaction, communication, repetitive behaviors, or restricted interests. So, oftentimes we hear, for example, they'll say, "Oh, my child has autism." And, the mother or the father would say, "My child requires different, different care, different daycare, or different, or just some, additional help, or a different type of interaction with my child as a student with a teacher." I know that, I remember I had a friend whose child, it tend to like repetitive behaviors. So he would always, for example, he would always go to the restroom and just flush, not use the restroom, just because he liked how the water repetitively went around in circles. So, like I said, it's that repetitive behavior that, or repetitive patterns sometimes that, is a part of this. But it depends. Not every autistic child or person will have the same issue. Possible eye contact difficulties. There's possibility of inability to read facial expressions, difficulties with social exchange and interaction. I know there's a series. I don't know if that series still. I don't know if this is a good example, but I know there's a series called The Good Doctor, or is it The Doctor? I think it's The Good Doctor, and I think the doctor, the main character, plays someone that has autism. I'm not sure, but yeah, it's just something to think about. Something to think. Physical disability, physical impairment, visually impaired, hearing impaired. This can really alter daily routine if the office is not prepared or if they don't know in advance. They might need more appointment time. The dental unit maybe have to arrange differently. And definitely we need to have, you need to really be a part of a team, and communication is a huge factor in that. But what are the types of these physical disabilities? Well, there's wheelchair bound, loss of a limb, fractured limbs, uncontrolled muscle movement, gait problems. So accessibility is necessary so that we can provide dental care to individuals with such disabilities. So we often have to think of things like walkways, sidewalks, the parking area, the hallways, the elevators, the width of the door pressure, adequate space around the door, the floor surface, is it carpeted? Are there rugs? Is it tiles? Restroom facilities, is that handicap accessible? The reception room design, the furniture style, the lighting, the operatory design. Can a person with a wheelchair enter into the operatory and slide over into the dental chair, for example? And ask if they need help, or, in transferring to a dental unit chair. Now, in your textbook, there is a procedure labeled as 21-1. I do recommend, rather require that all the students review that procedure. With the vision impairment, you must talk directly to the patient. You have to explain procedures since they really can't see you coming towards them. You have to let them know if you're leaving the room or if you're about to put on a patient napkin on them. You have to ask if they need help with guiding, and offer your arm. You can say, "I have my arm, my left arm near your right arm. So if you like, you can use my arm as a guidance." Even moving their wheelchair, if they're also wheelchair bound, you want to say, would you like me to move your wheelchair? Don't just go up to someone, because remember, these patients also, whichever they're lacking in vision or hearing, they're going to have a heightened senses of their other senses are heightened. So if someone is visually impaired, their hearing senses will be heightened. So you really have to be mindful of that. Also, some of these patients have a guide dog. It is a working dog. They don't recommend that you pet the dog. You must ask for permission to pet such a dog. Okay. For the hearing impairment, those people that can't hear, you have to communicate directly to the patient so they can visualize or understand what you're trying to say. Again, their senses are heightened because of loss of hearing. You want to remove extraneous noise like suction, music when you're communicating. Remove your mask because you're going to have to maybe they have to read your lips if that's how they communicate. You have to use mirrors, models, drawings, and written information to supplement communication. You got to keep the directions simple and maybe even perhaps provide them written copies. And some of them may even have a sign language interpreter, and that could be quite valuable. And maybe even your clinic could provide that service. For neurological disorders, this is more of the brain and the neurological system that become affected. This involves the CNS, PNS, and ANS. Okay. So those are all the different nervous systems. So examples of that is Alzheimer's disease, seizures, multiple sclerosis, CVA or cerebrovascular accident or a stroke. And with Alzheimer's, I think we've heard this a lot in the media and maybe even on TV shows that there is a mental capacity beginning at around the middle age, and then it progresses with increasing dependency, and then it gets really difficult for patients to ultimately perform daily function. And symptoms include things like memory loss, comprehension, judgment, intellectual capacity. And then after a while, I mean, you cannot help but understand that then these patients suffer from anxiety and depression. And that's completely understandable, but you have to be mindful of that. So what are the clinical considerations of someone who suffers from Alzheimer's? Well, you have to pay special attention to prevent it. You want to make sure I mean, not to prevent Alzheimer's, but to prevent any oral hygiene issues. So you want to make sure they have fluoride supplements or regular oral hygiene. They should be reminded of their appointments and even give them oral hygiene instruction. Their dental visits should be scheduled with the awareness of the patient's best time of the day, maybe when their memory is more heightened, or maybe when they have help at that time. Patients may even have signs of xerostomia of dry mouth that's caused by some of the medications they're taking. And the presence of a family caregiver often allays the patient fear. The patient often feels comfortable, as is expected, when they have a family member nearby. With seizures, this is more like a disruption of electrical impulse pattern that they suffer from with brain cells. And what happens is that the brain cells tend to move at a faster rate. That could be severe, it could be subtle. So there's different types of seizures, but we do give anti-seizure medications called Dilantin. Unfortunately, Dilantin does cause overgrowth of gingiva, like you can see here in the picture on the lower right. Now, when normally the solution to this is they have to cut these off, the gums off, because this is just an overgrowth of gums. And when you cut them, it's not like these are filled with blood. It has regular plain vascular supply to these areas. They're not like they're balloons, like if I pop it or anything like that. This is all fibrotic. So in a sense, that's good that you can just cut the gums off, but it is something to consider when you have to deal with any type of hygiene issues. So with seizures, you have something called epilepsy, which is the brain signals, the signaling is abnormal, and it's controlled in most patients with medication. But in a stressful situation like dental, a seizure can occur. So again, we go back to what we discussed a couple of weeks ago. We want to alleviate patients' fears. They already have all this epinephrine circulating in their body because of, oh no, what's going to happen? I'm scared. And then on top of that, they're literally at the dental clinic, or they're in the unit, and now their senses are, I mean, now their fear is even more heightened. So we want to avoid stressful situations. And then four main categories of such seizures are generalized seizures or grand mal. We also have partial seizures or petit mal seizures. And then we also have non-epileptic seizures and status epilepticus. Okay. Your book talks a little bit about the types of generalized seizures in detail, but you want to consider the clinical considerations. You want to be aware of trigger factors like light, sound, music. You want to be aware of an aura. Usually with kids, when there is an aura, the parent says they're about to have a seizure. So doc, step away. And you guys kind of just stop, let the child or the patient have their seizure. And oftentimes the dentist or the pedodontist would often ask the parent, how did you know that? And then the parent is like, I just can't explain it. They just, my child just has some sort of aura and I can just tell it's coming. Anyway, so sedation may help in in these situations, but you always have to be prepared for a medical emergency and follow protocol. So multiple sclerosis, or MS, is a disabling disease of the central nervous system, or CNS, and it disrupts the flow of the information, causing a disconnect between the brain and the body. One of the most common neurological disorders that affect adults between the age of 30 and 50. Okay, so that's pretty young. As the disorder advances, though, the patient experiences weakening of the lower extremities, causing muscle weakness, unsteady gait, and even paralysis. Unfortunately, there is no cure. There is no cure. So what are the clinical considerations? What do we have to think about? Well, we want shorter appointments. We want accessibility to their wheelchair. We want, sometimes they have difficulty, these patients, in localizing their intraoral pain and discomfort. There sometimes is a development of respiratory problems. Okay, so maybe their breathing is an issue. Maybe they are not able to breathe through their nose. So you don't want to position a patient in a supine position. So 45 degrees is usually better. It does take a toll on your back, but it's just better for the patient. So sedation may be required before treatment. Cerebrovascular accident or stroke. So the blood flow to part of the brain is stopped by some sort of blockage. It could be even a clot. The symptoms, well, the patient may have unilateral weakness, like one side of the body is now weak, or you have even paralysis of the eyes and facial muscles, as well as slurring of the speech or loss of speech. So what are the clinical considerations with a patient like this? You want to schedule them in mid-morning with an average of 10 minutes added to the appointment, and modified oral eye hygiene aids will help them. So remember, if these patients are partially paralyzed or they really can't move, they're going to have a hard time brushing their teeth, right? Maybe someone who is originally a right-handed person suffered a stroke and now their whole right side is having an issue. And now they have to use their left hand to brush their teeth, and maybe using both hands is difficult to floss. So you have to consider that and maybe come up with some different techniques in those appointments. With neuromuscular disorders, they affect the nerves that control voluntary muscles. And examples of those are muscular dystrophy, Parkinson's disease, cerebral palsy, ALS, amyotrophic lateral sclerosis, or ALS, and arthritis. So there are some clinical considerations. Once again, shorter appointments. Patients have to be transferred from the wheelchair to the dental chair. A dental dam may be useful if the patient could breathe through their nose. Again, keep them at a 45-degree angle. We should avoid sedation like general anesthesia, nitrous oxide, if they have some impairment of breathing. So muscular dystrophy is a group of diseases that causes weakness and atrophy of skeletal muscles, and that could be quite detrimental in breathing or pulmonary function. And then with Parkinson's disease, I think we've heard of this in the media, there's a loss of dopamine producing brain cells that affect motor skills. So there's shuffling, tremors, and it's progressive, and it's usually greater than 50 years of age. And again, this could be these convulsions, or rather shuffling or tremors, that can be exhausting for a patient. Can you imagine suffering from that on a daily basis? It's quite debilitating. And then there's cerebral palsy, which is non-progressive neuromuscular disorder, and that results from brain damage. It's usually from lack of oxygen to the brain, called anoxia. Usually like 1 to 4 individuals in 1,000 live births is affected. And then There have been many talks of ALS or Lou Gehrig's disease or amyotrophic lateral sclerosis that we mentioned in the previous slide. And that's progressive, that's degenerate, and that's fatal. And it results in the loss of motor neurons and the ability to move. And survival is 3 to 5 years, unfortunately, and there's just no cure, no cure. So what are the clinical considerations of these neuromuscular disorders? Well, once again, 45 degrees is their angle, right? When you place them in the chair. Shorter appointments, it has to be accessible, wheelchair to the dental chair, a dental dam, right? And we have to consider that they may have they may have impaired pulmonary function or breathing function. So we have to avoid the use of nitrous or general anesthesia. Arthritis. So there is a lot of patients out there that suffer from arthritis. I'm sure you've seen a lot of commercials. I'm sure you've seen a lot of commercials on TV that talk about treatments for arthritis. So it's a chronic disease of the immune system that attacks its own health tissue, and that causes inflammation and swelling of those joints. And then ultimately it results in some sort of stiffness. And you could see how, like in this picture of the hand on the right, that is a typical example of arthritis. And there's two common types. There's RA or rheumatoid arthritis, or there's even osteoarthritis. So physicians prescribe aspirin or corticosteroids to reduce the symptoms of arthritis. Uh, RA, which is one type, is chronic. It's pain, stiffness, swelling, loss of the joint function. It occurs when the immune system attacks healthy tissue. So what happens is you get inflammation, then you get joint swelling, and possible permanent joint destruction. And this is a typical example of someone with RA in this picture here. All right, so again, you got to consider shorter appointments, morning appointments is best. You want to think about these type of patients are going to have a hard time with their oral hygiene, with brushing, let alone their daily stuff on how they live with holding a spoon and eating. So can you imagine they're going to have a problem with trying to floss? So we have to think of creative ways on if they are able to chew properly and do their hygiene properly. Okay. Cardiovascular disorders are diseases that may affect blood vessels, the heart, or even both. And in heart disease, it's the leading cause of death among men that are greater than 40. And with women, it's among them greater than 65. And a lot of that plays with usually menopause or hormonal issues. But again, those are typical age ranges. The dentist must communicate with the patient's cardiologist and acquire the background on the patient management. So that's really, really important. And some of the common CV disorders are congestive heart failure, heart hypertension, angina, and endocarditis. Okay, again, avoid lengthy, stressful appointments. You could use nitrous. You could use psychotropic medication. Look at the vital signs for these patients. I would avoid epinephrine and vasoconstrictors. And a semi-supine position rather than a completely supine position would be great. Okay. Again, with the congestive heart failure, the heart is weakened. It doesn't have the ability to pump blood to the rest of the body. So the patient can't really exert much activity or much force on their body. With hypertension, it's another name for high blood pressure. High blood pressure, remember, is the name of a symptom, whereas hypertension is the name of the disease. Anyway, all in all, it's when the blood pressure is causing the heart to work harder. And with angina, there's chest pain, and that's caused by reduced blood flow to the heart, causing like a squeezing pressure and tightness in the chest. And then there's endocarditis, and that's infection of the lining of your heart valves and chambers. Okay. With CHF, there's a lack of circulation throughout the body due to the arteries getting narrow, scar tissue from a heart attack. And another name for heart attack is myocardial infarction. And congestive heart failure could be through high blood pressure, heart valve disease, heart defects, even endocarditis or myocarditis. So the heart works harder. When a patient has hypertension, as the heart is pumping against resistance, such as a blocked artery. American Heart Association says that 80 million adults are diagnosed with high blood pressure. And what are the factors that cause this? Well, age, if it runs in the family, smoking, obesity, and stress. Most high blood pressure patients are on drug therapy. They are recommended to limit their salt intake. They should have a certain diet. They should practice exercise and reducing their stress. So there's a great picture of how when the arteries are clogged and how they look, especially when there is a clot. Um, yeah, so or when there's a fat that's kind of clogging the area. And then there's angina. Angina pectoris. It's a coronary disease. It decreases blood supply to the heart, and ultimately that causes sharp chest pain. I think we talked about this during medical emergencies. There could be stable or unstable angina. Stable angina is pain and it's predictable. Unstable angina is also pain, but it's unpredictable. And you could just get it just by being seated where you are. People with angina are at risk for a heart attack. And another name for that is coronary atherosclerotic heart disease. And usually patients are recommended for drug therapy, exercise, weight control, limiting their salt, and stopping smoking. And then there's endocarditis. Endocarditis is when bacteria is carried in the blood system. When there's bacteria in the blood system, another name for that is bacteremia. So infective endocarditis is severe infection of the cardiac valves and supporting structures, and that's caused by blood-borne pathogens that gain entry to the blood. They can be from the mouth or even the GI tract, the GI tract. That's the whole small intestine, right? Large intestine. So it's quite a bit of a range. Pulmonary disorders are disorders that affect the lungs and respiratory system. So you'll have some sort of obstruction when you're breathing. And the disorders that fall in this category could be anywhere from allergies to asthma to even COPD or chronic pulmonary obstructive disorder. Now, with allergies, it's a reaction to a foreign substance or an antigen. With asthma, it's a chronic lung disease that now has narrowing of the smooth muscles in the bronchioles with shortness of breath, wheezing, and coughing. And with COPD, or chronic obstructive pulmonary disorder, there's blocked airflow due to respiratory disease. With allergies, as 1 in every 4 is allergic to something, and the body reacts basically to some sort of antigen. It could be a food, a medication of some sort. It could also be anything from dust mites, pollen, animal dander, food, or drugs. Most reactions are managed by over-the-counter medications or prescriptions, but if it's severe, then it's life-threatening. And I think we talked about how patients like this should be getting some sort of EpiPen that could save their life. Okay, so I think you have to pay attention to what patients are allergic to so that you can avoid the use of them or having those substances near patients when you're treating them in the dental clinic. Bronchial asthma is a chronic lung disease that basically airways are inflamed, and when they're inflamed, the opening is narrowed. So that causes like some sort of wheezing, chest tightness, shortness of breath, coughing, and it's usually at night or early morning. It often arises or comes from allergies. And then there is bronchial edema or swelling, and then there's a widespread narrowing of bronchial airways everywhere. And it usually starts in childhood. So you do want to minimize the stress of these patients and use shorter appointments. You should not really be using aspirin or epinephrine. You kind of want to avoid that since they are, epinephrine can enhance the negative effects of bronchodilators. And then there's COPD, or chronic obstructive pulmonary disease, is again blocked airflow during respiration. The 2 common types: chronic bronchitis and emphysema. So you do want to, again, it's a common thing. You want to keep shorter appointments. You do not want to use nitrous. You may want to consider using sedation techniques. You might want to not schedule elective treatment during hot and humid weather. The chapter then starts talking about blood disorders, and it can involve any of the blood cell lines. So the bone marrow can be susceptible to malignant cells, which can cause tumors of the bone marrow. There's anemia, leukemia, and hemophilia. Anemia, the blood lacks, healthy red blood cells or hemoglobin. Maybe even sometimes patients are on anticoagulant medication, like the medication causes the blood not to clot, leading to a blood disorder. And sometimes there's leukemia. And with leukemia, there's an excessive number of white blood cells, and that indicates some sort of infection going on or leukemia. And then there's hemophilia. And in hemophilia, there's excessive bleeding caused by a congenital lack of protein substance necessary for blood clotting that can occur in hemophilia. So people that have these blood disorders are susceptible to bacterial infection. You do need treatment modifications for any type of surgical procedure. Antibiotic prophylaxis may be needed to be prescribed or when you're planning on doing any type of high risk procedures. In endocrine disorders, or as it tells you, it deals with some sort of hormonal disorders. And the type of disorders that fall into this category are hyperthyroidism, hypothyroidism, and diabetes mellitus. But so hyperthyroidism, you have an overactive thyroid, like Graves' disease is the most common form. The onset is usually before 40. And in these cases, you have a hypothyroid crisis. But in hypothyroidism, you don't really have an active thyroid. So there's not much danger to dental. However, it is an issue. And then, of course, there's diabetes mellitus. With diabetes mellitus, you have to consider the healing power of the patient. Like, are they able to heal as the same as a patient who doesn't have diabetes mellitus? So some of the clinical considerations, you want to consider the thyroid gland and that it regulates the metabolism of body cells, okay? And it stimulates the passage of calcium into bones. But with hyperthyroidism, you have an overactive thyroid gland, which has Graves' disease. You know, patients have Graves' disease. Hypothyroidism, the thyroid gland is underactive. There's fewer hormones than usual. Once again, you do have to have a thorough medical history and medical consultation. With hyperthyroid patients who are not being treated are highly sensitive to epinephrine. So again, you have to consider, like, remember in lidocaine, you do have epinephrine in them, but in hyperthyroid patients, they're sensitive to epinephrine. So you have to consider what you're using. With diabetes mellitus, there is a constant high blood glucose level. And that's usually because they don't have insulin. There's a lack of insulin or they just don't have it. What are the causes? It's either by lack of pancreas, the lack of the pancreas's ability to make insulin. It's not being able to it's not able to transport the sugars into the cells. There's type 1 and type 2. So type 1 diabetes mellitus, the body doesn't make any insulin. None. So that's like juvenile diabetes. Then there's type 2. It can make some insulin, but not enough. And in those cases, that's what's called adult onset diabetes. Adult onset diabetes. So we talked about this in medical emergencies. There's hyperglycemia and hypoglycemia. Hyperglycemia, as the name suggests, there's too much sugar. Okay. And if you leave it like that, you'll get diabetes ketoacidosis, and that's life-threatening coma. You can go into a life-threatening diabetic coma. Then there's the hypoglycemia, where you have too little blood sugar, and that's also called an insulin shock, and that can manifest quickly, and most commonly it's due to missing meals. Patients just forgot to eat, and because of that, they have an insulin overdose without food intake. There's excessive exercise without adjustments of insulin. Again, you want to keep their appointment short, mid-morning, make sure they take their insulin or they have eaten. They use sedation techniques, maybe even nitrous or oral diazepam or oral anti-anxiety medication. Remember, we talked about when the medication ends in AM, it's usually an anti-anxiety medication. We want to instruct patients to maintain a normal dietary intake before the dental appointment. We want to minimize their risk of infection because these patients may have may be affected with how they heal because of the high sugar levels. And they have sugars in the office for those who may need it if they turn into becoming hypoglycemic. There's always good to have a piece of candy or like an orange juice nearby in the kitchen or wherever, so that patients can have that in case their sugar drops, because it gets very dangerous. So with behavioral and psychiatric disorders, that's what your book now talks about. These are parts that can contribute to many types of behavioral and mental disorders. Could be biologic, genetic, psychological, and even social parts to it. With the psychiatric disorders, it can affect the treatment of dental patients because of the drugs that are being prescribed. That can influence the function of their brain. What are some of these examples of these disorders? Are anxiety, depression, schizophrenia, and even OCD. OCD. Now, as your book tells you, there are some terms that it talks about, like anxiety is a feeling that all is not well. Nothing is well. Depression is a condition of general emotional rejection and withdrawal. Eating disorders are present when a person experiences severe disturbances in eating behavior, like anorexia nervosa, binge eating disorder, bulimia nervosa. And then there's bipolar disorder, and that's characterized by extreme happiness or elation, and then all of a sudden they're followed by depression. And then there's substance abuse that can affect all aspects of life. And then there's post-traumatic stress disorder. That's when you're re-experiencing a traumatic event. And with schizophrenia, it's a psychotic disorder characterized by a lot of different degrees of personality disorganization. So you do have to understand with these types of disorders that patients may be experiencing xerostomia as an adverse effect of the drugs they're taking. Regular hygiene and fluoride supplements and salivary substitutes are important because we want to kind of maintain their dental health. And then, of course, patient cooperation and informed consent may cause problems, particularly in patients with dementia. So those people that are not right, sound in mind, you often want to question, well, how valid is this informed consent? All right, that concludes Chapter 29, the special needs and medically compromised patient. Thank you.